So today we're going to be doing a compare and contrast between the arteritic form of anterior ischemic optic neuropathy and the non-arteritic form of anterior ischemic optic neuropathy, non-arteritic versus arteritic. And so when you're doing a compare and contrast between competing hypotheses, the first thing we want to do is look at the demographics of the patient, and that's usually age, gender, and race. And so for the arteritic form of AION, obviously it's going to be older patients. There's going to be more females, but males can get arteritis. And there has been a racial predilection towards Caucasian people, but any race can get giant cell. It's just less common. In the non-arteritic form of AION, it can occur in any age, but it tends to occur in vasculopathic patients. There's an equal male and female gender ratio, and there's no racial predilection for NA AION. Then you're going to look at the symptoms and the signs. And the symptoms, of course, for both AIONs is acute loss of vision. In NAION, it's usually unilateral and painless in NAION. And in AION, because it's arteritis, they might have headache, jaw claudication, scalp tenderness, and other pain problems. And if it's bilateral, you really should be thinking about arteritic and not non-arteritic AION, unless it's post-surgical or from a systemic cause like extensive hypotension or from a surgical procedure. The signs are the same in AION. The A means the disc is swollen. It's ischemic optic neuropathy, so there's going to be a relative afferent pupillary defect if it's unilateral or bilateral but asymmetric, and you're going to have disc edema. In NAION, the cup to disc ratio in the fellow eye is small, which is the structural disc at risk, and so if we see a big cup in the fellow eye, that's a big red flag that it's arteritic AION. The appearance of the disc edema is usually hyperemia in the non-arteritic form, and that can be sector or diffuse. But if you see pallid edema, it's pale and swollen at the same time acutely. That's more likely to be ischemic infarction from arteritis. Or if you see an adjacent cotton wool spot, and if we see two circulations involved, retinal and choroidal on a fluorescein angiogram, hypoperfusion or delayed choroidal perfusion, that really is the sign that it is arteritic AION. And of course, if we don't see the disc edema, that's not even AION, that's PION, and that's way more likely to be arteritic as well. Of course, the laboratory studies in both NAION and AION, you should do a sed rate and a CRP, and if they're elevated, that's more consistent with arteritis, and you should start treatment for that patient, steroids. But the definitive diagnosis for AION is doing a temporal artery biopsy. You could do a temporal artery ultrasound looking for the halo sign, and the lymphocytic infiltrate that we see on the biopsy has a correlate on the ultrasound. And the gold standard temporal artery biopsy is sometimes necessary to make the final differentiation between AION and NAION. But you should be thinking about this every time you see a swollen disc in an older patient. Is it arteritic or non-arteritic anterior ischemic optic neuropathy?